Hello everyone. Welcome to another free Capstone project idea presented by our team entitled Hospital Resources and Room Utilization Management System. Please don't forget to subscribe and click the notification bell to receive free updates. Technology is considered the modern-day enabler. It is the driving force behind the improvements in the medical and healthcare field. Different medical technologies like computerized systems, expert systems, and applications enhance the management and services provided by the healthcare sector. The Capstone Project, Hospital Resources and Room Utilization Management System is a system designed to streamline the process of managing hospital resources and room utilization. The said project is critical, especially now that we are facing a pandemic. There is a need for efficient management of hospital resources and room management. The management efficiency will prevent a shortage in supplies and overcrowding of patients in the hospitals. The Capstone Project, entitled Hospital Resources and Room Utilization Management System, is intended to be used by the healthcare sector. The system will be used to efficiently streamline the management of hospital resources and room utilization. The system will electronically process determining the availability of hospital resources like medicines, oxygen tanks, and rooms that are used for COVID and non-COVID patients in a centralized platform. The system will generate a report about the overall capacity of different hospitals in delivering efficient services amid the pandemic. The COVID-19 pandemic has seriously challenged the healthcare sector. The pandemic has challenged the capacity and resources of the hospital in providing sufficient health care to COVID and non-COVID patients. Conventionally, managing hospital resources and room utilization are done separately using early computerized systems. Availability of hospital resources like medicines and oxygen tanks for COVID and non-COVID patients, and status of rooms and beds in hospitals are managed and recorded manually. The pre-existing systems made hospital administrators face difficulties and problems in managing hospital resources and room utilization. Inefficient management of hospital resources and room utilization often leads to shortages in resources and overcrowding of patients. There is an intensified need to upgrade the systems used in managing different hospital resources and room utilization to increase the hospital's operational efficiency and improve patients' overall experience. To address the aforementioned concerns, the researchers proposed the development of an automated hospital resources and room utilization management system. The system is a centralized platform that will electronically process determining the availability of hospital resources like medicines, oxygen tanks, and rooms that are used for COVID and non-COVID patients. The system will eliminate the serious challenges and difficulties encountered. Different hospitals can now deliver an efficient report on their capacity and availability to accommodate COVID and non-COVID patients. Hospitals can better serve and provide services to the public, especially now that we are facing the COVID-19 pandemic. This project generally aims to design, develop, and implement a system that allows automated management of hospital resources and room utilization. Specifically, the researchers aim the following objectives. 1. To develop a centralized platform where different hospital resources and room utilization are managed. 2. To allow easy access to information about the records of hospital resources and availability of rooms. 3. To ease up recording, storing, and retrieval of records about the hospital resources and room utilization. 4. To develop a system that is efficient and reliable to use managing different hospitals. 5. To help reduce the possibilities of shortages of hospital resources and overcrowding of patients. 6. To efficiently accommodate and facilitate health care to COVID and non-COVID patients. 7. To evaluate the system in terms of user acceptability, effectiveness, quality, productivity, and reliability. This study mainly focuses on the development process of the hospital resources and room utilization management system. The project is intended to aid the process of increasing the operational efficiency of hospitals in rendering services amid the COVID-19 pandemic. The said project will ensure that hospitals have enough resources and capacity to accommodate patients. The researchers will gather a sample size of participating hospitals, staff, and patients to participate as respondents of the study. The success of the project is significant to the following individuals or groups. Hospitals/hospital administrators. The success of the system will directly benefit them. The system will improve their operation and services offered to the hospital's stakeholders, especially patients. The system will provide the management efficiency, which is essential for hospitals now that we are battling the COVID-19 pandemic. Patients, COVID or non-COVID. The system will significantly improve the health care services they receive from the hospitals. Researchers. The study will further harness the knowledge and skills of the researchers. Future researchers. The study can serve as their guide in designing and developing their version of the system. Hospital Resources and Room Utilization Management System is a database-driven system that will automate the processes in managing hospitals' resources and capacity to accommodate patients amid COVID-19 pandemic. The advantages of Hospital Resources and Room Utilization Management System are the following. 1. Automated management of hospital resources and room utilization are done electronically. 2. Records management. It is a database system that makes the records electronic, safe, accurate, reliable, and fast. 3. Report generation. The system automatically generates and provides real-time reports about the status of the hospital's resources and room utilization. This article will explain the forms, module, and user interface of the Hospital Resources and Room Utilization Management System. The paper will discuss the features and how the system works. The front end allows the users to interact with the system. It is a graphical user interface that allows the users to easily access records and use the system. The following information is displayed in the front end of the system. List of hospital with room availability. List of hospital with available medicines. List of hospital with available oxygen tanks. Hospital contact information directory. View notice board. This form allows the users to access the features and records of the system. This form requires the users to input the correct combination of their username and password. This dashboard serves as the main page of the system's administrator. This will display the essential records of the system that the admin can access. The dashboard mainly displays the following information. Number of hospitals. Total bed capacity. Occupied beds. Beds available. This form allows encoding of the hospital's information registered in the system. The admin will manage the following information of the hospital for recording and storing. The following information will be encoded in the system using the form. Hospital name. Complete address. Contact information. Email address. Total bed capacity. Bed capacity intended for COVID-19. Remarks. This module will allow the admin to manage the users of the system. The administrator can add another user account that can access the project. The following information of the users will be encoded in the system. Username. Password. User type, admin user, hospital user. Full name. Designation. This form will allow the admin to set up a database backup for the system. This page displays the report about the utilized beds in the hospitals for COVID and non-COVID patients. The report will be presented using tables and graphs. This form will display the report about the availability of oxygen tanks in every hospital. The report will be presented using a table reflecting the names of hospitals and the quantity available for oxygen tanks. The report is also available for printing. This form displays the availability report of the medicines used for COVID-19 for every hospital. The report will be presented using a table showing the hospital name, medicine name, and quantity available for every medicine. This form allows hospital users to encode information of the available medicine used for COVID-19. The following information will be encoded in the system. Medicine name. Available in, name of the hospital. Quantity available. This form will allow hospital users to input information on the available oxygen tanks in the hospital. The following information is encoded to present the availability of oxygen tanks. Tank size. Available in, name of the hospital. Quantity available. This page displays the report about the utilized beds in the hospitals for COVID and non-COVID patients. The report will be presented using tables and graphs. This form will display the report about the availability of oxygen tanks in every hospital. The report will be presented using a table reflecting the names of hospitals and the quantity available for oxygen. This form allows the hospital users to encode reports about the bed utilization of the hospitals. In this study, the development of the hospital resources and room utilization management system is seen as the solution for the challenges and problems encountered to efficiently manage the hospital's operation and services amid the COVID-19 pandemic. The result of the study showed that the developed system meets the predefined project requirements and needs of the target end users. The system has a high potential in eliminating the inefficiencies and problems in the pre-existing system. Hence, the researchers concluded is effective in increasing the management operation and healthcare services offered by hospitals. The system will ease up and simplify the process of determining the availability of hospital resources like medicines, oxygen tanks, and rooms that are used for COVID and non-COVID patients. The developed system will generate a report about the overall capacity of different hospitals in delivering healthcare services amid the pandemic. Based on the significant result of the study, the researchers highly recommend the implementation of the system. It is recommended for its efficiency and reliability that can be rendered to the target users. The system will ease up recording, storing, and retrieving hospital resource and room utilization records. Different hospitals can now deliver an efficient report on their capacity and availability to accommodate COVID and non-COVID patients. Hospitals can better serve and provide services to the public, especially now that we are facing the COVID-19 pandemic. The following are the specific recommendations of the researchers. 1. The researchers recommend that hospitals should install and use the system as a centralized platform to manage hospital resources and room utilization. 2. The implementation of the system is highly recommended, for it will improve the operation and efficiency of hospitals in providing healthcare services amid the COVID-19 pandemic. 3. The researchers recommend the use of the system, for it will make hospital resources and room utilization management efficient, fast, convenient, accurate, and reliable. Thank you for watching. For more free Capstone projects, ideas, and resources, please subscribe and click the notification bell to receive free updates on our channel. You may also reach us on our Facebook page and website.